Hello students, my name is Dr. Jyoti Prakash, Assistant Professor, Department of Management, School of Management Sciences, Lucknow. Now today's topic of discussion is on current trends in healthcare industry. Obviously healthcare is one of the important or the crucial aspect from a service provider point of view as well as a customer point of view. So, it is very important to know the important aspect or important trend and the important element of healthcare industry. So, today's topic is totally based on these elements. So, healthcare industry is basically a wide and intensive form of services which are related to well-being of human beings. Obviously, it is somehow related to giving someone some sort of protection about their health and safety and hygiene in fact. And rising income, greater health awareness, lifestyle diseases and increasing access to insurance will grow to this particular industries. So, these are basically the sum of the positive point which are responsible for the growth of or which have contributed a lot in basically in the growth of this particular industry. Healthcare has become one of the India's largest sector both in terms of revenue and employment. Means this particular sector is obviously generating employment or providing employment opportunity to different people, and obviously they are able to generate more and more revenues because in the scenario we are very much aware to see the different types of diseases and problems nowadays they are coming in our day to day life. So, these are basically some of the aspects which contributed a lot and we supported a lot in healthcare industry in generating revenue by providing the services to the customers and to the patients too. Healthcare market is in India is expected to reach 372 billion US dollar by 2020, and the government of India basically aims to increase healthcare spending to 3% of GDP by 2020. So, if we talk about healthcare, healthcare includes these type of facilities and these type of components included in that, like healthcare includes the hospitals. Obviously, hospitals like government hospitals and private hospitals are there. Government hospitals includes healthcare centers, district hospitals and the local hospitals, and if we talk about private hospitals like nursing homes and mid tier and top tier private hospitals and multi speciality and super speciality hospitals. So, healthcare includes hospitals where a customer or where a basically patient can go and accordingly seeks some sort of redressal about the diseases that they have. The second sector or the second thing come under healthcare is pharmaceutical. Pharmaceutical includes manufacturing, processing, purification and packaging of the chemical material for use as medication for human or animals. We can say that pharmaceuticals includes the medicines in form of tablets and capsules and some sort of chemical material which is basically provided to the patient or to the customers in order to get rid of that the diseases that they have. The next one is diagnostic. It comprises business and laboratories that offer analytical and diagnostic services like body fluid analysis and different checking different checks of the internal bodies from where a customer can get an idea about the internal problem that they have, and accordingly they can be treated and they can be taken advices from the doctors to get rid from that. The next one is medical equipment and supplies. It includes establishment or the facilities like surgical, dental, orthopedic and laboratory instrument. The next one is medical insurance. Nowadays, it is gaining so much of importance because now insurance firms are providing medical facility to the patient. So, accordingly they can invest their money in these buying these type of policies, and at the time of requirement they can avail the facility in terms of cash or in terms of non cash in fact. So, medical insurance includes under healthcare industry. And the next one is telemedicine. Telemedicine has potential or has is basically one of the scheme of government which somehow fills the gap of urban and rural areas availability of the drugs and the medicines and the facilities, means rural people are unable to basically get the facility or get the modern facilities of treatment. So, this is some sort of facility provided by the government or provided by the healthcare industry to rural people, so that they can also get the facilities of healthcare. In fact, healthcare obviously comes under service industry, and it is one of the service industry. So, again we have come on the topic of like service triangle, in which there are three players. In the previous classes of mine, you just see what is the meaning of or what are the components come under service triangle concept. Like service triangle in case of hospital, hospital is all about the company, means the hospital basically wants to make certain sort of money and profit and just generate revenue, so that they can survive, and they just make available the facilities and the medicines to the customers, and they just invest more and more money in expanding the branches or in expanding more facilities to the patient. So, hospital is all about, or we can say that hospital is all about the company. Doctors means doctors are the one who can be the employees, or who are basically the employees come under or work under hospitals, and they are the one who are directly interacting with patient or who directly interacts with the patient. So, they are basically the intermediary, or they are the middle one. They are helping the companies in fulfilling the objective that the company has, means whatever the objective the hospital is carrying out, means they want to make money, they want to generate profit. Doctors basically help them out, help the company or help hospitals in basically fulfilling the objectives that they are carrying. And doctors are the one who are directly interacting or who are adopting interactive marketing strategy. They are interacting with patient, and patient are basically having some sort of problem. They accordingly represent that problem to the doctors, and as per the different problem or as per the individual problem, these doctors basically solicits and they just give advices to these patients as per the individual problem. So, we can say that these three players are working in a basically triangle form, or they just facilitate or they just help one another in fulfilling the objective of one another. Like the objective of a patient is what? To get some suggestion or to get some treatment through which he or she can get rid of that particular disease. So, and doctors, what are the objective? What is the objective of a doctor? Means if he or she is serving or giving their advices in treating the diseases of the people, so in return they can expect the salary or the money. And what is the objective of a company or the hospital? They want to make money or they want to earn profit. We are very in the earlier example we have understood that hospitals are earning profit, and how they are earning, because doctors are accordingly providing assistance to the patient, and how patients are fulfilling the requirement, they are interacting with the available doctors. They are just representing or they are just asking them to regarding the problem, and doctors basically accordingly they just prescribe some sort of medicine to them. So, in we can say that these three players are able to fulfill their objectives by interacting or by adopting different types of marketing strategy. If we see here, it is external marketing strategy. External marketing strategy means hospital are making promises that if a customer, if a patient is coming, they will surely get some sort of assistant. Internal marketing strategy means hospital is now hospital has adopted a good human resource practices with its doctor, means now they are providing good amount of salary or remuneration, and they are also giving some sort of security and welfare scheme to the doctors. And this is basically interactive marketing strategy, means there is an interaction between the doctor and the patient. Accordingly, they are interacting with each other and fulfillment the requirement of each one. So, in service triangle we are able to see that by interacting or by adopting different marketing strategy, these three players are able to fulfill their requirement and the goals that they have. The next one is service marketing mix of healthcare industry. As a service student or as a student of service marketing, you just understand the different elements that you have to deal with while you are working or while you are dealing in a healthcare industry. Like the first one is a product. Product is what do you mean, what can be come under product in case of healthcare industry. So, a product refers to the medical procedure delivered by a provider or the hospital, or the medical equipment or the pharmaceutical sold to the customer for their personal use. In fact, means in hospital whatever the treatment or the procedure that they are going through, for what they have to pay a particular price. So, product is all about the facilities or the medical equipment or the pharmaceuticals, means the medicine that they are purchasing, that is all about the product. The price, what price a customer has to pay for availing for purchasing the product of healthcare. Like pricing is all about based on whatever the type of facility or whatever the type of treatment or whatever the type of medical equipment and pharmaceuticals you are purchasing and you are using. As per that, you as a customer you have to pay that price for that. In fact, means whatever the type of treatment you are getting from that particular hospital or from that particular service provider, according to that you have to pay to that prices. So, in healthcare industry, price varies from one person to another, means it is totally based on the requirement or the problem of one patient to another patient. Means one patient is obviously having a mild fever and another one is having a severe disease like cancer. So, obviously accordingly the treatment requires different money from both of them. So, price is totally based on the treatment that they require or that they will be go through in that particular industry or in that particular service provider. Place is obviously the establishment or the location of that particular hospital. So, while establishing or while taking decision on the element like place, service provider or the owner of the hospital has to consider the factors like the convenience factor and the transportation facility and the nearby facility, the stores nearby facilities, means like the ATM facilities and some sort of food facility should be available nearby the hospital. So, that if a patient is coming to the hospital for getting some sort of treatment, if he or she is feeling hungry, so go to a food corner and does not have money to pay for that particular problem or that particular procedure. So, accordingly by going through or by having the facility of ATM, he or she can withdraw the required money in order to fulfill the requirement. So, location basically plays very important role in case of hospital, and being a service provider you should take special care in taking decision regarding the location of or the establishment of the hotel. Why it is so? Because of avoiding inconvenience, and you should provide the adequate transport and communication facilities so that a customer find ease in accessing and coming to your hospital. In fact, and while deciding the location of the store, you should also take care of the atmospheric condition like pollution and the environmental and ecological condition too, so that a customer does not feel any type of congestion and suffocation here. So, these are basically some of the aspects come under place. So, in place basically the location of or the establishment or the setup of the hospital at a particular location, and that comes under the place. Promotion, hospitals for promotion use either advertisement or PR or both after taking into consideration the target customer, media type, budget and the sales promotion. Promotional techniques are basically of two types, like personal and impersonal. Personals are like the doctors and the employees of that hospital. If a customer is going to a, suppose if a customer goes to a hospital and asks for which type of doctors are available in orthopedic segment and in physician segment or in gynecologist, what are the gynecologists are available in this particular hotel. So, the employees or the representatives are basically giving information to that particular patient So that is all about personal, means directly by interacting face to face with the customer or with the patient, the employees of the service firm or employees of the hospitals are basically giving information to them. So that is all about personal promotional technique. And in impersonal is all about like advertisement and PR and some publicity and some public relation activities if hospitals are doing. Suppose hospitals are just hospital is organizing one free health checkup campaign. So that is all about a public relation activity, and by doing so they are also trying to promote the name of that hospital in the eyes or in the mind of the customer. So promotional technique is all about personal and impersonal. People means what? The person or the employees or the representatives of the service firm who are just able to, who are delivering the services to the customer, who are basically directly interacting with the customer. In the earlier videos or in the earlier classes of mine, you just see that people means what? Means employees, the customers and the intermediaries which somehow help the companies in delivering the service, in making available the service to the customer. So in case of hospital industry, the people like doctors, nurses and staffs, they are basically available in the hospital as in different segment or in at different places in order to fulfill the overall process of the hospital industry, or in order to give the overall experience or the full experience to the customer about the healthcare. Next is process. Process in case of hospital, basically there are two types of process that a customer or that a patient has to go through. Like the first one is outpatient and second one is inpatient. What are these two? So the first one is outpatient. If we see, like outpatient means meeting doctor at appointed time. Suppose you have to come to the you have to go to the reception or the counter where you just get an appointment with the concerned doctor. So at the appointed time, you are just meeting out to the concerned doctor, and accordingly you are representing your problem to that doctor. So meeting doctor at appointed time, he or that concerned doctor is just diagnosing or identifying the problem of yours after listening to your words, after listening to you, that whatever a customer, basically whatever a customer is representing the problem to the doctor, he or she basically tries to analyze that. Accordingly they just prescribe the treatment, and after basically treatment, they just go through certain sort of medication and just medicine, and that is all about outpatient. Means if a customer is having a mild or some less sort of disease, so this particular process can be followed by him or her. So accordingly he or she firstly he or she has to take an appointment, and or the given time or the appointed time he or she has to meet out the required doctor and represent the problem. As we have seen that there are two types, so obviously I have explained the first type of process, that is outpatient. In this particular process, a person, customer or basically a patient has to take up appropriate appointment of the concerned doctor. At the appointed time, he or she has to meet out that required doctor, accordingly represent the problem and just get some advices regarding the treatment, and after getting that level of treatment, he or she basically takes some sort of medicine, and this particular process is complete, means this particular service delivery is complete. The next one is inpatient. Inpatient, basically this particular process is followed by a patient or by a customer when he or she is having a severe disease in fact. So he or she has to go through these three stages in fact. So what are these three stages? And inpatient is all about when a patient is going in or coming into the hospital or for getting rid of the particular disease. And if we talk about outpatient, means a customer is or a patient is coming, and after getting some sort of advices, he or she just goes back to the required places or to their homes in fact. So if we talk about inpatient, inpatient is all about when a patient is coming into or in the hospital in fact. So, in this particular process he or she has to go through the 3 stages or the phases, like the first one is joining phase. Joining phase includes the activities like the arrival of in this particular phase a patient basically arrives at the hospital, and he or she involves the process of registration. The second one is the second phase is the intensive consumption phase. In this diagnosis, treatment and information about the future action. So, accordingly the doctor basically analyze the problem and prescribe the medicine and the suggestions, and obviously they also give certain sort of advices about the future action or the activities that they have to follow. And the third step is all about detachment phase. Detachment is all about the activity, means discharging that patient from the hospital after paying the payment of the overall procedure or of the overall process that they have gone through or that they have adopted in that particular hospital. So, that is all about these all things come under the concept of process. The next one is physical evidence. The next evidence or the last element of service marketing mix is physical evidence. Physical evidence is very important in case of any service or every service industry. Why it is so? Because of the characteristic of the services, because how a customer can get an idea about the facilities, about the process, about the existence of their service organization or the particular hospital. So, a service provider or a hospital has to include or has to introduce certain sort of evidence, so that if a customer comes to that particular hospital, so he or she will get an idea that at what place he or she just to go and require and fulfill the requirement that they have or that he or she has basically. So, in physical evidence the hospital introduces the evidences or the physicality or the tangibility dominant in form of the counters, means the registration counter or the front office or the front face where a patient comes and accordingly just seeks certain sort of inquiry and questions to that person. So, hospital counters, emergency wards, single room, common ward, dress code of different persons, like how you can identify that that person is, that female is nurse and that female is basically a doctor. By obviously by their dress code you are able to identify the different role of different persons and different people involved in healthcare industry. So, physical evidence includes the elements like making or introducing the tangibility element in the overall process or in the overall actions of the service provider. So, these come under physical evidence. Now, the next is what current trends in healthcare industry. So, now let us have a discussion on this particular topic. So, what are the current trends nowadays in healthcare, like shift from communicable to lifestyle diseases. Now, in the scenario we are very much aware to able to see in that the communicable diseases are less, but people are now facing lifestyle diseases because of the lifestyle, means they do not have time to get to take some exercise or take some yoga or medication and take rest. Because of these particular activities they are having some sort of diseases like having cholesterol and blood pressure and poor diet, and they are having a habit of obviously taking consumption of alcohol. So, these are basically some sort of lifestyle diseases nowadays faced by different people, and this is obviously a common trend or the current trend in hospital or healthcare segment. The second justification or the second trend is like expansion to tier 2 and tier 3 cities. Now, hospitals are basically expanding their branches to tier 2 and tier 3 cities in order to provide the facilities medical or the modern era or the state of the art facilities to the patient or the customer nowadays. Like in example we can say that Vassal Healthcare is one of the first hospital chains to start focuses on tier 2 and tier 3 cities for expansion, means now they are expanding their branches to these cities in such a way, so that they can also provide some sort of medical facilities of to customers there. Next, emergence of telemedicine. Telemedicine, as I told earlier, this concept too, like telemedicine is basically a fast emerging sector in India, and major hospitals like Apollo, AIIMS and other hospitals have adopted this particular service, and they are just providing this particular facility to the different patient or to the different people in order to connect with the facilities which are available in urban areas in fact. And telemedicine market in India is expected to rise at a 20% growth rate in the coming time, and it will reach $32 million by 2020. Next, artificial intelligence. Artificial intelligence is all about using the technology in order to fulfill the requirement of the customer, means now patients are directly interacting or directly consulting the doctors, physician and expertise to the best treatment. Means now in COVID situation we have seen that doctors generally avoid physical contact or physical touch with the patient. Now they are offering the facilities like online appointment and online checkup. Customer just do the payment and accordingly seek advices and get consulted with the required doctor in a online mode, in a virtual mode. So it is one of the contribution of artificial intelligence. It is also capable of solving problem of patient, doctors and hospital as well as the overall healthcare industry. Obviously, by providing the facility in online mode, patients are also fulfilling their requirement, means now they are getting rid of the particular disease that they have. Doctors are also fulfilling the requirement, means now by taking fees and charges from the patient, they are also fulfilling the requirement and their objective too. So, artificial intelligence basically help every players or every entities involved in healthcare industry. In fact, home healthcare is all about making available the healthcare facilities at the doorstep of the patient and the customers. Means now we are very much seen the practice of free sample collection, and in COVID situation, as people are avoiding to go to the physical touch and the hospitals in a offline mode. So, they are now calling some representative or some labs to send some representative in order to collect a sample of the particular disease in order to check out. So, home healthcare is also there, means as per the changing requirement of the patient, of the customers, now hospitals and doctors are making available this particular facility at the doorstep of the customer and the patients. The one of the increasing or current trend is what the increasing penetration of health insurance, means now insurance companies are providing different health insurance policies to the customers. So, as per the requirement or as per the pocket, they can opt any one or any appropriate policy in order to fulfill the future requirement of that is related to basically the healthcare and the medicine. And healthcare is obviously gaining momentum in India, and it will rise in by the end of the financial year 51 lakh 516384 crores. In fact, means now we are very much aware to see that it is an increasing rate of nearby like 17 to 60% growth rate. Due to basically the contribution of the different insurance industry, because they are now offering health insurance policy to the patient. So, they just get relaxed, and that the coming time or in future time, if they pay and if they incur certain or so much of cost, they can recover their money, because they have investment, they have done investment in buying certain policies related to health. Next, mobile based health delivery, like sample collection mobile lab of the country, namely mobile BSL 3 VRDL lab was launched, because with the help of mobile, you can also take facilities or related to healthcare, and they can also be delivered at your doorsteps. Technological initiatives like digital health knowledge resources, medical record, mobile healthcare, electronic health record, hospital information resource system, telemedicine, these are basically some sort of things, technological things are available which have contributed a lot, and which become basically the current trend followed by the healthcare industry nowadays. And the next one is luxury offering. Luxury offering is all about now healthcare industry or hospitals are offering the luxurious facilities or the luxurious amenities to the customers, so that they just feel less pain, and they have, for that they are very much happy, or they are willing to pay any price. Means now females are opting like painless delivery, and they just go for cesarean delivery. For that that person, that female has to pay more price, but accordingly they just want to they do not want to be a certain sort of basically pain and risk. So, that is all about luxury offering. They are offering a high benefit or basically luxurious benefit or offering to the customers, and simultaneously they can charge more price from the customers or from the patient too. So, basically these are the two references I have mentioned. You just go through if you want to get more information about the healthcare and the current trend in healthcare industry. That is all in this particular topic. So, thank you students.